Multisystemic Therapy by Aya Said. So what is multisystemic therapy? Well, it's a family-based and community-based approach to addressing the various determinants of serious clinical problems, increasing the chances of youth being placed at high-risk out-of-home placement. Initially, MST was developed for youth engaged in serious antisocial behavior and their families. MST aims to understand a specific clinical problem and use it as a guide to develop a treatment approach. Conceptualization of clinical problems refers to what can be said about the likely factors leading to the pattern of functioning we wish to change. MST focuses on the youth and their entire world, such as their families and home, friendships, school and teachers, and neighborhoods. Often it is a home-based model focusing on removing barriers related to service accessibility for families. Therapists work closely with families and are available 24 hours, 7 days a week, with small caseloads of approximately 4 to 6. Services are provided based on youth and/or family convenience. MST therapists focus on parental empowerment and improving their effectiveness by identifying strengths and developing natural support systems. Some examples of support systems include extended family, neighbors, friends, and religious congregation members. They also aim to remove barriers such as parental substance abuse, high stress, and poor relationships between partners. MST services target families with children at risk for out-of-home placement to foster care, group homes, residential treatment, or correctional facilities. They are time limited, flexible service delivery to meet familial needs and delivered in their home. They are tailored to the needs of family members and curated to meet context of a family's values, beliefs, and culture. Some goals of MST include increasing caregiver discipline practices, improving affective relationships within the family, decreasing youth affiliation with deviant peers, increasing youth affiliation with prosocial peers, boosting youth school or vocational performance, involving youth in prosocial leisure outlets, and establishing an Indigenous family safety net comprised of extended family, neighbors, and friends. The intervention method follows 9 principles. Principle 1. The primary purpose of assessment is to understand the fit between the identified problems and their broader systemic context. Principle 2. Therapeutic contexts should emphasize the positive and should use systemic strengths as levers for change. Principle 3. Interventions should be designed to promote responsible behavior and decrease irresponsible behavior among family members. Principle 4. Interventions should be present, focused, and action-oriented, targeting specific and well-defined problems. Principle 5. Interventions should target sequences of behavior within and between multiple systems and maintain the identified problems. Principle 6. Interventions should be developmentally appropriate and fit the developmental needs of the youth. Principle 7. Interventions should be designed to require daily or weekly effort by family members. Principle 8. Interventions efficacy is evaluated continuously from multiple perspectives, with providers assuming accountability for overcoming barriers to successful outcomes. And finally, interventions should be designed to promote treatment generalization and long-term maintenance of therapeutic change by empowering caregivers to address family members' needs across multiple systemic contexts. David's case is a brief example of the various complex obstacles youth may be faced with. Therapists would then implement the 9 principles to the treatment. David is a teenage Caucasian male that has a history of association with deviant peers, stealing, substance abuse, and problems in school ranging from fighting and truancy. He also has caregivers that have alcohol and substance abuse problems, where his mother is addicted to crack cocaine and his mother's boyfriend is an alcoholic. The therapist would take this all into consideration using the 9 principles to give the youth a better quality of life while sustaining their relationship with their caregivers and incorporating other support systems in the process. In David's case, it included his biological father and stepmother, who were crucial in stabilizing his environment while his mother and her boyfriend were getting treatment for their substance abuse and alcoholism. Effectiveness research on MST has been done through randomized treatment and control designs with longer than average follow-up lengths. Research has shown that it reduces the likelihood of recidivism and incarceration for serious juvenile offenders. It can reduce delinquent or antisocial behavior along with alcohol and drug use among juvenile offenders. MST has shown improvement in participating youth functioning in academic settings, work and home, along with positive peer relationships and improvement in family functioning. It decreases delinquent behavior, sexual behavior problems, incarceration, residential treatment for youth charged with sexual offenses, and MST has shown effectiveness in gang-involved youth. Thank you for listening to my presentation. You have come to the end. Be sure to check out these resources if you are interested in multisystemic therapy. Have a good holiday.